Welcome, everyone. My name is Andrew Smith. I'm the Senior Community Engagement Manager at Dbsa, and I will be your Zoom jockey for this session. We're glad to have you here this year with us. And thank you for joining this session. We're excited to have Phyllis Foxworth, Vice President of Advocacy, share about 8 steps that you can take to make systemic change to the mental health care system. Please feel free to add any questions you have to the chat, and we will attempt to either answer them in the chat, and we will also reserve time at the end to ask your questions of our speakers. We also have Robert Dabney Jr. with us, and he is our manager of the Dbsa Peer Apprentice program, who will be presenting as well. We will also be having some time for small group discussions toward the end of the session as well. So we will put you into a breakout room. We'll have some questions for you to discuss, and then come back and report out on those discussions. So we'll ask that everyone, that each group select a recorder to write down the discussion and a reporter to report out to the larger group from that discussion. So without any further ado, I would like to introduce Phyllis Foxworth.
Thank you, Andrew, and welcome everyone to this. I believe this is our last session of the day, presentation of the day. And this is really focus on advocacy in the question if you are wanting to know how to bring about systemic change in your communities around the topic of mental health and what you personally can do. So first off, I'm just going to quickly run through the program agenda, and I will also share that I have been having some internet connection problems. I've been freezing. So if you lose me for a moment or two, that seems to be what it is. It doesn't seem to last more than a couple of seconds. But, you know, and if I've been frozen, just let me know that, hey, go back and repeat what you just said, because we missed it. All right. So this is our agenda today. We're going to, as Andrew said, we're going to review the 8 strategies to bring about systemic change. And in particular, what we're going to be focusing on is 8 strategies to bring about systemic change with regards to mental health and the advocacy priorities of Dbsa. Robert Dabney Jr. then is going to pick up after where I left off and talk about what we've done at Dbsa, how we've put this into action already. So he's going to share with you a little bit of what has already worked. And then we will, as Andrew said, break out into small group discussions where you'll take, you can take what I've with you. You could take the use case scenario. What's inspired you? What might you be able to do back in your own communities to bring about systemic change as we talk about mental health? So the first thing I want to share with you is that although Dbsa is a peer-focused organization, in this broader scheme of the community, this broader, wider community, we're referred to as a patient advocacy organization. So patient advocacy organizations are across all different types of conditions and diseases. Your Cancer Society has patient advocacy organizations, diabetes groups have patient advocacy organizations, as well as mental health organizations. But the main role and focus of a patient advocacy organization is to provide patient and caregiver-oriented education, advocacy, and support services. So when we talk about peer support, that's what Dbsa is focused on. But remember that the wider community thinks of those types of organizations as patient advocacy organizations. And they might not be familiar with the word peer. So that's why it's kind of important to use language that the broader community is aware of. Additionally, these organizations often play a very significant role in educating the public, lobbying with government officials, increasing research funding, as well as changing legislation related to the diseases they represent. So again, Dbsa does all of this. So for those of you who might not be familiar, we certainly are focused on educating the public around mood disorders. We are certainly focused on lobbying our government officials to provide better resources for treating mood disorders. We are definitely involved in research. We have many research projects, and that probably would be a great session sometime just to share with you all the different research projects Dbsa is involved in, as well as focusing on changing legislation related to mood disorders. So as I said, today we're going to talk about strategic 8 strategies for bringing about systemic change, especially as it pertains to mental health, and especially as it pertains to the mental health priorities of Dbsa. So what are our advocacy priorities? First and foremost, it's to increase access to peer support. We also then, as we look at the access to peer support, we want to focus on developing the state and veteran credentialed and certified peer specialist workforce. We want those paraprofessionals out there in the community providing peer support. And then as our third area of priority is to reach broader communities with our Dbsa programs. So what are those programs? Our chapters, our support group meetings. Other programs are our educational resources, as well as our advocacy work. So we want to make sure that we're reaching a broader audience all the time. So when you think about engaging with other organizations in talking about systemic change, it's important to kind of think about what is the ecosystem that is really involved here. Now, there's obviously lots of different organizations involved, but for our conversation today, we're going to kind of focus on these main organizations that really we need to engage with to bring about systemic change. Those being government agencies. Many of you are familiar with the federal agency called SAMHSA, but there are local mental health boards and your local communities. There are state mental health agencies at the state level. There are mental health agencies at the county level. There are mental health agencies at the city level. We also then have elected officials. So these are the people that you elect to to pass legislation that you want done and passed that furthers systemic change in mental health reform. There are social service agencies that we need to interact with. They really are great partners for us. So Dbsa can't do this alone. We need to be working with other agencies in the community that are also very focused on bringing about systemic change. Another category that's extremely important is funders. We could never do this if we didn't have money coming from foundations, from government grants. So funders is a big bucket that could include the private sector, which could be, when I list over here the private sector, I'm talking about primarily public corporations. They often will fund projects. So systemic change really benefits from having funders who are allies with you and bringing about that systemic change. So having set the foundation for what's necessary, let's talk then about what are the 8 strategies for systemic change. The first one is to create a robust case for change. And when I say that, it means to use science-based information to help stakeholders understand the problem and how it affects them. So while on one hand, it is absolutely important to have our personal stories, those personal stories, when they're backed up by facts, make for a much stronger case when we're trying to bring about systemic change. The second step is that you need to make the information accessible. So again, it's not, if you're only talking to yourself and meaning only other people's in your community, then the word's not getting out. So if you have, as you're making this case for, creating this robust case for change with all this wonderful data that you're collecting, you need to make sure that that information is shared. How do you share that? You create collaborations. Remember when I talked about those social service agencies and other allies? So you create collaborations where we help align our mindset and goals that enable shared learning. In again, it's important that we can't do it alone. We need to have the support of allies that are going to help us. And another reason that those allies are so important, and they help us make the information accessible, they get the word out, but they can spark new innovations. So if we're only talking to ourselves and we have our own thoughts and ideas, we're kind of limiting, putting blinders on. Opening up our space and bringing in allies really sparks new ideas and new innovations. The fourth strategy is to create disruptive innovations and routes for them to scale. So it's important that there be, so what does disruption mean? It means doing things that are not the way they used to always be done. And making the case that doing things in a new and different way brings benefit and value to everyone. There can be potentially new ways of operating. 988 lines are a new way of operating. The whole implementation of 988 systems, for those of you who aren't familiar with it, it's a new federal mandate that all the local governments and agencies have to have a new phone number for people to dial for a mental health emergency. It's called 988. That's very disruptive. That's taking those resources away from 911, which typically are not as qualified to handle those calls, and placing them in other areas where people are answering those phone calls that actually have the skills and the compassion to answer those phone calls. So think back to, a decade ago when someone had the innovative idea, they sparked new innovation, said, hey, how about we make 988 a national hotline number for all communities? That was a disruptive innovation. And then they worked with government agencies on a route to scale that. That was federal policy that says every local municipality has to fund a 988 number. The fifth one is to demonstrate proof of concept. And so if you've had some new innovation, it goes back to creating that robust case for change using science-based information. So if you've got the proof of concept, you have to be able to show how you're going to make it work. I'll use that 988 example. They had to show proof of concept that, well, we can do this with the existing suicide prevention hotline as a way to kick it off. We have this proof of concept that the suicide prevention hotline has been working for decades. Now we need to scale that and make it a 988 number available in all municipalities. The sixth strategy for systemic change is to develop policies that facilitate and reinforce systemic change. So again, now we're getting into the government and policy work. We've had these great ideas. We should demonstrate proof of concept. Now we need to get backing from government government agencies and our legislators that they're going to make sure that the resources are available to implement the change that we want to make. So there's ways that you can do that through tools like taxation and subsidies. That's what's happening with 988. The different states and the different municipalities are looking at ways in which they're going to fund that 988 phone number. And then shift culture and mindsets and behavior. And this one is probably the hardest one to do, but it can be the most effective because it changes the way people think about something. And so I'm going to use that 988 example as something that, right now, so many people are not even aware that 988 is available, that it's there for them to call. But just think about when 911 came into being. I mean, if some of you might be really young and say, I was born, 911 was always there. But I can tell you, when I was growing up, 911 was not always there. We would get these big phone books and you would get a magnet to put on your refrigerator and say, this is the number you use to call the police, and this is the number you use to call the fire department. It took a long time for people to change their minds, like, oh, I call 911. I don't have to memorize that 10-digit phone number to call the police or the fire department or an emergency vehicle. So shifting mindsets and behaviors is probably the most difficult, but it can be the most impactful once it happens. I mean, no one today would think about dialing a 10-digit number to call an ambulance or the fire department. And then, it's circular. Once you've accomplished steps 1 through 7, then you develop new rules and measurements so that you can go back to step 1 again and create a robust case for change based on all the facts that you've gathered about this latest implementation. So The first thing I want to share is that systemic change is not for those who are looking for instant gratification. It takes a long time, but it is extremely rewarding if you can follow these steps and create a strategy and a plan to make it happen, and you have the perseverance to stay with it. So I'm going to kind of walk you through some ways in which we have been able to use this. So first off, then the first one was create a robust case for change using scientific evidence-based data. Dbsa has done that in our area of peer support. So we know that peer support is evidence-based. And when we are working with advocates who want to be creating systemic change in their communities, we educate them on what is the scientific evidence about peer support. In general, we know that from research that's been done, that support groups share features similar to group psychotherapy. And they instill hope in people who attend only a mutual support aid group for 1 year were less likely to be depressed and had more friend resources. That's a great piece of information to share with someone when you want to talk to them about the value of peer support groups. For example, your story is extremely important to share that what you got out of a peer support group. But when you can back that up and say that this is what the community as a whole is getting out of the peer support group, your message is that much stronger. So that's in general, mutual aid groups. This is the value of mutual aid groups. But now let me give you a little more detailed information. This is research that was done on Dbsa support groups. So right now I have been lobbying with Congress to pass some legislation to provide funding for support groups. So one of the ways that I can bring about systemic change and get support groups out in every community is to share with them this and make this case with them that people who attend Dbsa support groups reported higher levels of being informed about their mental health condition, acceptance of their mental health condition, confidence about their treatment, optimism and control over their future, and better self-esteem. And again, what's important is that, yes, I can go in and share my own personal story and tell them that these are the things that I personally have received from a support group, but how much better to back it up with research, credible research that says the research shows that this is what the effect of attending a support group meeting is. So that's for peer support groups. When I think some of you who attended Douglas's session earlier this afternoon might have heard him talk about the different pathways of peer support, that there is peer-to-peer support, those where two individuals are supporting each other. That was what the first piece of evidence that I shared. But it gets even better, folks. There is evidence that shows the value of peer support services. So for those of you who attended Douglas's session earlier this afternoon, he talked about the difference between human-to-human peer-to-peer support and peer support services that are delivered by a paraprofessional who's been trained as a peer support specialist. So I'm going to walk you through some of the evidence about the value of peer support services that you would be able to use when presenting and making a robust case for change. But first, we need to share with you some definitions as I go through this. Engagement, we're going to be talking about engagement. Engagement means connecting with the mental health, with the network of healthcare, being able to make that connection to the resources that are going to provide you the services in the first place. Activation occurs when an individual, after they made that engagement and been able to access the care, now they're engaged with their care. They're beginning to think about ways that they want to participate in that care. And they want to make decisions about their own wellness and eventually leading to their own recovery. And recovery means the ability to effectively manage one's mental well-being. So first we need to get engaged with the resources that are going to provide the care. Once we're getting the care, we need to take ownership of our own care. And that's what activation is. And then if those two are successful, many people, hopefully most people, are able to move into recovery. And in utilization, and that's can be very important to the particular audience that you might be speaking to, that's the direct cost for healthcare systems to deliver care. So you can think about the audiences that might be really interested in utilization. That could be, your legislatures or your social service agencies or those federal, those government agencies. They might be really concerned about the delivery of care and how much it costs. So let's talk a little bit about the value now that I've introduced you to those 4 concepts. Improved outcomes through engagement. And again, everything that I share with you here is research-based. This isn't Dbsa or Phyllis just saying, hey, this is what I think. This is all based on published research. That when there is engagement, it improves the individual's relationship with their healthcare provider. They better engage individuals in care. And it significantly increases the individual's ability to manage systems. That's something that peer support services help individuals do. They help them navigate the healthcare system. They help them as they try to find the resources to get mental health care. So that engagement is the very first step. And when they're receiving peer support services, the research shows that they have a much better ability to manage and navigate those healthcare systems when receiving peer support services. Because you can't start getting better oftentimes. That's what it takes, is to get that engagement going. So value equals improved outcomes through activation. So remember, we talked about once you get activated, once you're engaged and you have the resources and you're engaged with those resources, now you want to take control of your own care. You want to be involved in your own care. You don't want to be a passive recipient of your care. You want to actively have a say in your care and decide what the treatment outcomes are that you're seeking. So it's proven, again, this is not Dbsa saying this, this is not Phyllis saying this. The published research shows that people who receive peer support services have an increased sense that treatment is responsive and inclusive of needs. So if you don't think that the resources you're receiving is responding to what your needs are, you're probably not going to stay with it. But those are people who receive peer support services are more apt to say that they feel that the treatment they're receiving is responsive of their needs. And they are clearly more activated in self-care and wellness. So they're taking part in taking care of what is important to them and managing their care. Rather than relying on somebody telling them what to do, they're taking an active role in their care. And one of the ways in which this is proven is that there are certain tools, outcome assessment tools that people take that show that when I started with my treatment, this is the score I received. And as I stayed activated in my treatment, those scores went up. I was, felt like I was more engaged. And that's a scientific way of measuring the value of those peer support services. And so another value is improved recovery. Again, the research shows that people who have access and are availing themselves to peer support services have an increased sense of hope. They have increased self-esteem and confidence. And they have an increased sense of control and ability to bring about change in one's life. And I think that Douglas, for those of you who were at Douglas's presentation earlier this afternoon, he talked about the 5 steps on the wellness journey. And that activation, and that you're starting out with, okay, I'm just getting engaged. All right, I'm activated, but now I really want to be in control of my own life and in my own care. So that's really, when you've gotten to that recovery. So again, there is the data and the evidence, the scientific data that shows that people who receive peer support services have an improved recovery. So remember, I said it depends on your audience. You need to always, when talking, know who your audience is. There are going to be many members of your stakeholder community there that I showed you earlier that are going to be really concerned about, but what is this all going to cost? And again, the evidence is there to show that peer support services actually drive down cost. This is just results of one managed care organization's results. So what are managed care organizations? They're insurance companies that have been given a contract by an employer. They've been given a contract by a government agency to say, here's the population we're going to give you this contract. It's your job to take care of the health and well-being of that population. And here's a set amount of money that we're going to give you to do that. So it's not, what you think of as fee for service, that, okay, you use these services, now you get to bill the employer or the insurance company for those services. With managed care, the contract is that I will take care of this population, keep them healthy, and you're going to give me a set amount of money to do that. So for them, it's very important that they control those costs. And so this is just an evaluation from one managed care organization's results, that those people that were in their pool of clients and patients that they were taking care of, they saw that if the reduced hospitalization over a 5-year period, there was a reduced 30-day admissions, and that they had those people who were receiving peer support services had below state averages for inpatient days. And they also saw that it reduced their reliance on formal services while at the same time achieving positive recovery outcomes. So those stakeholders who are interested and concerned about the cost, that's very important to them, that they were not needing to have formal services that were costing a lot of money. At the same time, they were achieving positive recovery outcomes, those recovery outcomes that I just showed you earlier. So these are all great topics for, depending on the stakeholder you want to talk to, that you can say, I'm creating a robust case for change. Here are the facts. This is why we need more peer support services and more peer support specialists in my community. So this is just one example of a Dbsa strategy that Robert is going to speak to, that we've used with our peer apprentice program. So I just walked through you steps number 1, create a robust case for change. I told you all about the research that is out there that says when people receive and have access to peer support services, here are all the positive results that happen as a result of that. So make information accessible. Robert's going to talk about the way that Dbsa has reached out into the community to get this information out to them about the value of peer support services. Create collaborations. He's going to talk about the ways in which we've used peer councils to bring allies together. Not only did we inform them about the reason, not only did we create a robust case for change and make that information accessible to them, we created allies through this peer council. And then there's now the evaluation being done on the results of those peer councils. And that's where they will be able to look at what are some things that we want to change and create a proof of concept around. So that's 3 and 7, implementing the peer council output. So once we've analyzed, what did we learn from these peer councils? Then we have the opportunity to say, okay, what are some programs that we want to create at a systemic level based on what we are learning? And then, we need to shift the culture and mindset and behaviors. Again, if we have a good program with demonstration project, and that's something that Dbsa has been involved in for many years, is these demonstration projects to show the value of peer support, so we can show the proof of concept. And we did those demonstration projects from funders. We go to funders and say, hey, we have a great proof of idea. We just need a proof of concept. Funders are willing to do that. That's what their many reasons that they're there, is to help organizations who have a great case to say, I just need a proof of concept so I can take it to the next step. And then that's how, once you've been able to do that, you start shifting the culture and mindset and behaviors. We talked about that with 988, that again, educating people to call 988 instead of 911. And then you develop rules and measures and standards for the new normal. So again, that takes you all the way back to, I said, the research becomes the evidence. Once you've had those demonstration projects, your funders say, okay, we funded that demonstration project. You now can go to a funder and say, I want some actual research done. And now you have evidence. And so now you have evidence about how these peer support services are working in the small little arena that you chose to work in. And with Dbsa, we've done research around the value of our peer support groups. We've done research around one-on-one peer support counseling. So that now becomes evidence that I can share. I will share with you that in the past summer, I have been talking to about 14 different Senate offices, US Senate offices, And I've been able to use this evidence to say this is the value of peer support services. We actually have legislation that we're trying to move this year, that a bill that's out there that would give more funding for peer support services. But you can imagine how much better those conversations were because we had those demonstration projects and we had that research. So it wasn't just Phyllis on behalf of Dbsa saying, hey, I think this is a good idea. I was able to back it up with some real hard evidence. Okay, so Robert's going to share with you what the Peer Apprentice program has done and how they've put it into practice.
Yes, thank you, Phyllis. Hello, everyone. As Phyllis said, I'm the Robert Dabney Jr., the Peer Apprentice Program Manager. And the peers and I have been very active in Chicago over the last 12 to 15 months. And what we're going to do right now is just take a few moments to look at 3 of the activities that we participated in and see how these 8 strategies for systemic change plays a part in that. The 3 categories that we're going to look at are health fairs, peer councils, and community collaboration. And so as we have here the health fairs, just to start off before going through the slide, I want to let you know that we were able to implement, if not all, most of the 8 strategies for systemic change throughout this year. And health fairs, I want to say we covered about 4 of those strategies. And they are made information accessible, we created collaboration, we demonstrated the proof of concept, and we shift cultures and mindset and behaviors, all just by having our peer apprentices engage with individuals at the health fairs. And so as we see here at the health fair, step 2, made information accessible. The ways that happened is that the peer apprentices and myself shared resources and information with community members on mental health. We share with them ways of coping when experiencing a crisis, how to support a family member when going through mental health challenges, and also how to reach out to 988 or have an open and honest conversation with a family member who we may suspect is experiencing some things that they may not feel comfortable sharing. And it's while doing these things, these conversations we had, they served as a catalyst to get community members to talk about their own experiences or experiences of someone close to them. And what this did was allow the peer apprentices to be more specific with the resources and information they share with that individual. And this was just one step in just having a conversation that really got the ball rolling on making a change in our systems. Next slide, please. We also see here that we created collaborations. By being invited to so many of these health fairs, we did, I want to say 6 over the last year, being invited to participate in these community events really provides a great example of how creating collaborations can make changes in the overall system. These events introduced historically marginalized communities to Dbsa and its resources and allow for the peer apprentices to connect with other like-minded organizations, becoming a mental health resource for those organizations specifically. I speak of one organization called Centers for New Horizons. They're a very large organization that works with individuals from the lower socioeconomic backgrounds, and they provide many things outside of just mental health resources, but they also provide them with food, clothing, financial resources. But at one of these health fairs, we were able to connect with them. And after they found out what it was we were doing as an organization and what the peer apprentices do on a day-to-day basis, we found ways to create a collaboration. And in that collaboration, even if we, by we, I mean the peer apprentices and myself, aren't able to attend one of their health fairs, they request information from us at all times about mental health and the resources that are available. And so even though we aren't there in person, we're able to provide those resources. And this is just one of the examples of collaborations that have been created over this 12-month period that is really making a difference in the Chicagoland area. Also, number 5, step 5, we demonstrated a proof of concept just by being at the health fair. As we mentioned earlier, we were able to model appropriate disclosure concerning our lived experiences in a manner that is open, honest, and proud. By someone like myself being a peer myself, being able to look someone in the eye and talk to them in a confident manner about the experiences I've had with mood disorders, in a way that didn't shroud it or didn't come with any stigma. It really helped to open up the conversation and get them to talking. And this is just one of the proof of concepts that can be seen. As Phyllis said earlier, we really like to look at scientific-based outcomes. And one of those outcomes is on disclosure, just helping individuals learn to be open and honest about what it is their experiences helps to individuals feel as if they have more control over their situation and not be plagued with stigma. And before we go to the next slide, I did catch the question about peer apprentices. I want to speak to that real quick. A peer apprentice is someone in the Dbsa program that is taking training to become a certified state peer specialist in the state of Illinois. And so we have a one-year program that takes individuals from just being someone with a mood disorder, educate them, provide them with the training, provide them with the resources and the requirements necessary to sit for a test in the state of Illinois to become a certified peer support specialist. And so that's who I refer to as I refer to peer apprentice. At the moment, we have 4 very dedicated peer apprentices in our program, and they're really making a big difference throughout Chicago. Next slide, please. Also, as it relates to health fairs, we had the opportunity to shift culture, mindsets, and behaviors. And so, as we mentioned earlier, our peer apprentices model appropriate disclosure concerning their lived experience in a manner that's open, honest, and proud. This helps to reduce stigma and allow others to live their truth in public unashamed. Also, by modeling these ways of being, we are consistently working to shift culture, mindsets, and behaviors, especially when we're able to share Dbsa's I'm Here presentation with the attendees. The Dbsa's I'm Here presentation is a 30-minute presentation that teaches participants how to have a conversation around mental wellness with a loved one, again, without shame or stigma. This equips them, the individuals we engage with, it equips them with tools and resources they can then take back into their homes and communities and practice it with their loved ones and their family members, and help to, once again, adjust those cultural shifts and mindsets. Being someone from a Black community, a Black culture background, mental health is something that isn't talked about easily. It's becoming more acceptable nowadays, but it isn't something that's talked about easily. And so just by me being someone talking to my loved ones, talking to community members about this, automatically begins to create that shift. And that's what it is we're talking about today, shifting these cultures, mindsets, and behaviors. And the peer apprentices and I have been able to get that ball rolling by attending these health fairs over the past year. Next slide, please. The other category we want to talk about is the peer council. Before getting into how these systems, the strategies of change have played out, I'll just speak to very briefly what a peer council is. A peer council is made up of peers, individuals with a mood disorder or substance use disorder, of course. The peer council is made up with, our peer councils at least, was made up of 7 to 10 individuals from a particular sector of the community to discuss issues that relates directly to those peers in that demographic. And so in our program, we had 2 peer councils running. One peer council was focused on the BIPOC, Black and Indigenous people of color, veterans on the south and west side of Chicago. And that peer council was focused on finding out what those veterans, what type of experiences they have had engaging with peer specialists, whether it be in the VA or in some other organization. What experience has they had with those peer specialists, and how do they believe they can best be helped by those peer specialists? And so what the focus of the peer council is to hear directly from the individuals in the community about their experience, and then working with them, find out more information about ways not only can Dbsa provide better or more knowledgeable or community-specific resources, but how can we inform other community centers, other hospitals, other living rooms what can they be doing that can really help and speak to this demographic themselves. And so the peer council, again, is a group of individuals that come together, all share a lived experience to be able to discuss ways that organizations that serve them can do that better. And so in our peer apprentice program, we had 2 of these peer councils running. As I said, one focused on the BIPOC veterans on the south and west sides of Chicago and how they engage with peer specialists. The second peer council we ran, the peer apprentices ran, was on Black males with a mood disorder with lived experience in Cook County. And so it was meant for any Black male that had a mood disorder or a lived experience in Cook County to come together and discuss ways that the peer specialist and the other resources peer specialists offer can be better suited for them. And so step 1, creating a robust case for change. These individuals, as they came together, we were able to gain a proper understanding of what resources were already known, what was available, and what has been utilized by each of those particular demographics, while also comparing that to what resources were known and made available by the Dbsa and other mental health care providers and other community health behavioral centers. And what we're finding is that there are things that are available and the community members who say that they need these, but they're just unaware that they exist. And so this is one of the ways we begin to create this process of change by just gathering information from the people that are expected to utilize these services. And can we go to the next slide, please? Thank you. Also with this peer council, our apprentices also then worked with their peer councils to create and distribute a survey made for their specific community to gather more intel on what was known and utilized by other community members. And so these peer councils, what this means is these peer councils, after they sat around the table for a few weeks, talked, discussed, had a better understanding of what's there, what's not there, what's needed, they then put all their collected information together, created a survey, and went out into the community to other peers and got their feedback on what they thought could be more useful for that community. And what the goal is to bring this information back, put it into a nice system. I'm going to get into that, put it into a nice report and find ways to distribute it to other organizations that serve these communities. I added here that an exercise like this, the surveys, the peer councils, coupled with the publicly available statistics, can really work to help to create a system, can really work to create a need for robust change, to create a case for robust change. All right, and I'm gonna move on from that point. And also, yes, the peer councils work to make this information accessible. And so the next step is to create their report of the survey that details their findings, along with finding unique ways of sharing the information with community members and the organizations that serve them. And so as I have noted here, this will be done via webinars, podcasts, YouTube videos, or simply word of mouth. I'm a very creative individual, and one of the things that I was talking to the apprentices about early on is let's find innovative and new ways to distribute this information. We haven't really gotten the answer of how we want to do that yet, but it's something that's still in the works, and I'm excited to see what comes out of that. Next slide, please. All right, and finally in step 4 for the step 4, create disruptive and innovations and routes to scale them. So by making this information we collect accessible to the people and organizations most concerned with the findings, we're creating more opportunities for the birth of disruptive innovations that change the health equity landscape, reducing disparities that plague communities for generations. It's something that, again, I'm excited to see what comes out of it. I added a little TBD here because it's still to be determined what disruptive innovations will come out of the peer councils we had running over this past year. Thank you. Next slide. And finally, we're going to look at community partnerships and the ways that our community partnerships has helped us in these 8 strategies. And I'll just go through them very quickly. We, in community partnerships, we can see a few of these strategies for change. We have the step 1, create a robust case for change. We made information accessible. We created collaborations. We demonstrated proof of concept, and we developed new rules, measures, and standards for the new normal. And so some of the ways we did that, by partnering with organizations like Chicago Urban League, Thresholds, Breakthrough Urban Ministries, we've been able to pair our passion and our resources with historically marginalized communities in their neighborhoods and the places they feel most comfortable. And so what this means is that by partnering with organizations like Chicago Urban League and Thresholds and Breakthrough, they already have a target audience. They already have people they serve and people that look to them for service. And so by creating these partnerships, the Peer Apprentices, Dbsa, we've been able to really put minimal strain on our time and resources because the audiences are there. We've just been able to partner with these other organizations and be an additional resource that they're able to offer to people that they're already serving. And that has really shown much success. And as I refer to marginalized communities, I'm speaking about particularly Black, Brown, Hispanic, smaller communities that haven't had access to resources over the past few years, decades, centuries. And so, next slide, please. All right, and also in community partnerships, we've been able to demonstrate our proof of concept and develop those new rules, measures, and standards for the new normal. And I just have here, by working with these unique public organizations, we reach broader audiences and speak to various stakeholders across the city. This helps us to get the message of hope, change, and thriving to many different communities and their leadership, which sets the stage for new rules, measures, and standards at the ground level, thereby ushering in greater opportunities for the changes to be called for and carried out by leaders in civic and mental health care arenas. And so these are some of the ways that our peer councils, our health fairs, and community partnerships have assisted Dbsa in reaching for in implementing the 8 strategies for systemic change. And next slide, please. And this is the individuals that put in their work. I say we, but they really did all the work. The 4 individuals that were part of our first cohort, you see them sitting there with their smiles on their faces. This is what that was at one of the health fairs we participated at with the Chicago Urban League. Had a very good attendance, and we were able to just connect with the community. And this is something that we really love to do. And at this one event, we were able to do all 3. We were able to create that robust case for change. We made information accessible. We created collaborations. We demonstrated our proof of concept, and we began to shift cultures and mindsets. And this is I want to say, all it takes to get the ball rolling. We don't need much. We just need people that are willing to do these things. And I'm grateful for our peer apprentices that put their time and use their experiences to be able to get this ball rolling here in Chicago. Next slide, please. All right, next slide, please.
All right. I was stuck there. Sorry about that. So thank you, Robert. That was so very inspiring, because I want to share that, the Peer Apprentice program consists of Robert and 4 other individuals. So, it could be intimidating to say, well, Dbsa National, you've got the whole national organization behind you. But keep in mind that it was a small, mighty group of people who did this in the community. And they're bringing about some very significant change in Chicago with just a handful of people who took a look at those 8 strategies for change. It, had and built a plan about how they were going to bring about systemic change. And I also want to remind you the caution that I gave you at the beginning. Bringing about systemic change is a marathon. It's not something that happens overnight. It's not something you will get instant gratification as you think about your plan and as you are able to look at the tasks that are in that plan and you're able to see the results of those tasks, that's where the instant gratification comes from. But it is a marathon, and you get gratified by, I ran the first mile and I clicked that one off. Now I'm going on to mile 2. So, it was very inspiring to hear from Robert what a small group of people have been able to do. And I think that, we all have a role to play, and we all can be a part of this. So what we're going to do now is break up into small groups. When you're in the group, it'd be helpful if you all introduced yourselves to each other first, and then just ask someone to, be a secretary to take down the notes that everyone is talking about, and ask someone if they will be willing to report out. Because what we'd like to do is use this as a time for innovation. Remember, we talked about one of those strategies was, innovation comes from through collaborating with others outside of yourself. So you'll have the opportunity for some innovation and creativity to take place. And then you can report out on what are some of the things that you thought about, how you can go back to your communities and start to think about ways to implement systemic change. So the 2 discussion questions that I'd like for you to discuss is, did anything mentioned in the presentation inspire you? Was there something that you said, wow, that's really great? Based on that, think about that inspiration and think about how you could put that into practice using those 8 strategies. Again, no one is expecting anybody to do this on their own. It takes collaboration, it takes allies, but it's putting one foot out there first and dipping your toe in. That's really what kicks it off. I think that Robert and the peer apprentices would be able to say that they had no idea the amount of change that they were going to be able to bring forward in just the 12 to 13 months that they've been active. So we'll do that for about 15 minutes, and then we'll ask people to come just back and report out. You have your recorder. Just share out 1 or 2 ideas that people were talking about, so that we can share that again with even the broader group of people that are here this afternoon, and that will spark even more innovation. All right, so you're going to be put into a room, and then when it's time to come back, you'll see a button that says you're coming, like they'll have a countdown 1 minute or so to come back. And do they need to join the room, Andrew, or will they be put into the room?
You should have a box that has popped up on the middle of your screen inviting you to join a room, and please click to join the room.
Okay, so you look for your name in that box. Got it. Well, welcome back, everyone. Everyone's gathering. It's so nice to see everybody back again and see your faces without the PowerPoint presentation. So, we don't have a whole lot of time for report out, but Andrew was checking those rooms and said there was great, robust conversation. So it was a balance of, do we interrupt the great, robust conversation for a report out, or do we let you keep on talking? So we don't, I'm very mindful that we have about 7 minutes left before, in this session. So why don't we I'll call on each one of you, the rooms, the groups, and maybe you can just kind of give a quick overview about what inspired you, and how you might take that inspiration and put it into action. So room 1, do we have a reporter?
And in case you
you might not know what room you were. That's right.
Yes. So room 1 was the room that Sheila was in.
So who else was in that room, Andrew? Oh, Melinda?
Yes, Melinda was in there, I believe.
Do we have to unmute people, or how does that work?
Everyone should be able to unmute. Oh, no, they aren't. Now they can.
Okay, very good. All right, Melinda, go ahead.
Okay, well, we discussed funding for marginalized groups, and we were talking in depth about that, where some states have more funding than others. Ladies, back me up so I don't be the only one speaking here. Sheila?
Yes. Barb will back you up.
Thanks, Barb.
And so did you have any thoughts on how you might be able to bring about some systemic change with that idea?
I think we were talking about getting the word out about warm lines and just resources that are available and making sort of broadly available. I mean, even on our 4-person call, one of us didn't know. I didn't know. So
Yeah, yeah.
we already learned something.
Well, no, and you should not feel like that's like, oh, I didn't know. It just went into effect in July. And I think that is a great place for individuals to start in their community to bring about systemic change, is that education around 9/8 and everything that it means. And I will share that Dbsa has a toolkit for advocates to learn more about 9/8 and how you might be able to take it out into your communities. So that's a great idea.
Can you guys hear me?
Yes.
We actually we got together. There was a question that had arose, and any questions came up out of that. So I was letting them know that I am a peer support apprentice class, and that someone wanted to know, what if I need a support group for recovery or whatever have you. And I was letting her know that DBS has a support group line, central support group line that they can go to, and I was letting them know that we have a warm line that they can call, and whatever issue they may have. And it went pretty well. It was interesting, and just I was letting them know DBS is helping to bring awareness in the marginalized communities, and you guys are helping to spread the word. And that's how come one lady wanted to know, well, why the funds weren't there in the beginning. I said, well, things is changing now.
Right.
We're bringing about a change now. We're bringing awareness to everybody. Right. And I was letting them know that there is money poured into DBS to supply the peer support specialists to, do their jobs and spread awareness to communities.
Right.
So.
Right. All right, let's quickly move on. Thank you so much. But I'm very aware of the time. Let's quickly move on to room 2. Who wants to report out from room 2? And Andrew, can you just share?
Room 2 was the room that Eric was in.
Okay.
Do you want to go, Eric, or do you want me to?
Go ahead, Stephen. You look like you were taking notes.
Okay, I was taking notes. But yeah, Eric is great and was able to contribute, and Tom to kind of help maybe make some of us aware. We had a couple of people who are more active in their local communities and other people that are kind of wanting to be more active. And so I think we were able to kind of, even though we maybe have different areas that we're all from and have different maybe major concerns or priorities, that there's ways of people to connect with. Like there's a lot of organizations potentially in place and a lot of resources potentially in place. And yeah, Eric did a good job of kind of pointing as to where to go to find out where to go, so that you can just go and meet people and be there for the conversations and stuff, and start making things happen. So I found that a very actionable thing to kind of think about. So yeah, I appreciate that.
I think that's great, Stephen, and I appreciate that comment. That where do you start? Well, no one's asking you to start something on your own. Like that's that would be difficult. But finding the resources of other organizations that they're mental health, as I call them, patient advocacy organizations that are peer focused, and are focused on mental health, contact them and see what you can, how you can start working in your community. That's a great way to get engaged. All right,
I will note that Tom talked about the state mental health planning councils. Which I happen to have just been appointed to the DC Mental Health Planning Council. So we actually had a nice dialogue about that. But I think it was Ray or no, someone asked about how do you find out what to do. I think it was Steve actually mentioned, how do you find out about your local program? So I said, well, go to your state mental health program website and look to see, because every state is organized a little differently. But so we suggested that a good place to start is with your state mental health agency.
Yes, that's great. That's a great suggestion. All right, room 3, take us home. Who was in room 3, Andrew?
That was the room Nicole was in.
Okay.
I think I'm sharing out briefly. Though jump in, Nicole, if you want to jump in. So we spent about half our time talking about some of the obstacles to either getting care, receiving care or seeking care in different communities that we were part of. And folks talked about things around stigma, things about trauma, food equity, lots of things like that that might vary from community to community and impact the kinds of supports that people need. And then we spent a little bit of time talking about sort of the hope of mobile crisis units as a way to support people. So beyond just 988 and also the obstacle, people not necessarily knowing, like there are lots of resources you can find out about if you know about your local office of mental health. But if people don't even know to go there in the first place, then how do people find out about these resources that might help them or help their loved ones? So we didn't get very far into the brainstorming phase, but that was kind of where we were at. If anyone wants to add anything else.
And I would just like to add that, 98 is the start of it is that mobile, that phone line, but it is much bigger. And it's, so for those of you who are being inspired from this session today, 988 includes mobile crisis as well as alternatives to the emergency department. So when it's fully implemented, it will truly be there for people with experiencing a mental health crisis. And that's a great place for people to get started. I've seen lots of things in the chat from Andrew's sharing you with the 988 toolkit. Eric's great suggestions about the councils. Every city and county has a mental health council. I shouldn't say every, I don't know that, but they should. And they look for peers to be on those councils. So again, that's another way to get involved and start sharing the peer perspective. It is now 2 minutes past the session. I guess it shows that it is a good session when people hung around, even though we're 2 minutes over time. We are here at the Dbsa Peer and Policy Advancement Team to help you out. Please feel free to connect with us after this week or even tonight, whenever, and we can put you to work on bringing about systemic change.